So I've been asked, how are extractions different at a biological office? A lot of times this question comes around root canals themselves because root canals are kind of a hot topic. And if you have a root canal treated tooth that's infected and you want to remove that tooth, then a lot of times people are wanting to do that at a biological dentist. So, what's different at a biological office? It's hard to say because we're all different and we all have our fun little gadgets that we use. There's some are more common than others, like PRF, ozone, those are pretty common. But then depending on how much space we have, um, then you may have different gadgets than we have for healing afterwards or supporting the technique afterwards. So I'm just going to go over what we have in my office. And if you have questions, let me know in the comments. Um, so the first thing we want to talk about is, are we going to do this treatment sedated or awake? I will say in my office, it's about 50-50. And if we're talking about a root canal tooth that is infected and needs to go, then I usually encourage my patients, if you have any hesitation at all, then I think it's a much nicer experience if you are taking a little nap through that procedure. And if you do, then I have my sedation dentist come out and he does IV sedation. I've worked with him for many years and trust him, he does a great job. But again, I have about half of the people would rather be awake. The difference is, and again, this is all personal preference for me and what kind of uh, sways my opinions one way or the other, is root canal teeth don't always like to come out in one piece. The root canal will, because there's no blood supply to the tooth tends to get more brittle over time. And so the tooth is more likely to break when it's on its way out. And so if you are hesitant to feeling that pressure and having me work on the tooth for a while, if that's going to bother you, then it'll be easier for you and easier for me if you're napping instead of having to white knuckle the dental chair. Then nobody's happy during that procedure. So sedated or awake, some people are like, it's no big deal. Just get me numb with local anesthetic and I'll be fine. And they do great. And some people are like, no way, you just wake me up when we're done. So two equally good options. If it were me in my mouth, I would choose to take a nap, but I'm kind of a wuss. So there's that. Um, okay, now we're going to remove the tooth just like any other dentist would remove the tooth. And we're going to remove what's called the PDL, the periodontal ligament. For a while, there were a lot of functional medicine doctors and more integrative doctors who, and I don't know if this is still a rumor that's going around or not, where they're like, you've got to remove the ligament, you've got to remove the ligament, and thought that you had to go to a biological dentist who was trained to remove the ligament. Well, that's I don't think that's actually the case because I was taught in dental school that you remove the tooth and you always clean the area as good as humanly possible to make sure that the periodontal ligament is removed during the extraction. So any dentist should be removing the periodontal ligament. So I don't know that that's biological specific. I don't know if that's something that only biological dentists do. Just any good dentist will do it. Um, Once the tooth is removed and everything that we can feel is cleaned out and it feels like good, solid, healthy bone underneath, then we may use a laser to help clean that up. We may use more targeted ozone in that area to clean up. We will absolutely be using what's called PRF or platelet rich fibrin. And that just means we're going to do a blood draw before we even get started with the tooth. We will have already taken a few test tubes of blood, spun it in our centrifuge, so that what floats to the top is that beautiful golden platelet-rich fibrin that contains all of the stem cells and healing factors that help that tooth socket, help the extraction site heal just that much better and that much prettier and faster. It also gives something to place in that socket so it's not just wide open and you don't have a hole in there while it's healing. So that's nice too. So we will have already done the blood draw. We'll have already gotten our PRF plugs. Um, there is a chance that we will mix that PRF with some bone graft material. Depends on what we're doing in the area. And again, it depends on the patient's preferences. We have some people who really prefer not to do a bone graft, but if you're going to have an implant in that spot, or if you just want to maintain the thickness of the bone, then a bone graft is really nice to do. Now, if you are one of those people who is hesitant about the sources of bone graft, if it makes you uncomfortable, then yes, we can talk through all of those options. I keep several different kinds. I think right now I have 2 or 3 different cadaver sources of bone graft material and 1 synthetic. Um, the cadaver source bone graft does tend to do better. It tends to be a little more biocompatible than the synthetic. But we talk through all of those options. We can even, muscle test, use a little applied kinesiology to see what your body might like better, what it might respond to better, and kind of go from there. So we have several bone grafting options if you're choosing to do a bone graft. Afterwards, I like to have an IV nurse come in and do some IV vitamins. That just helps inflammation for one, because we're doing vitamin C, helps process any of the medications, process any just ick that might have been in and around that tooth, with glutathione to help restore, um, give some anti-inflammatory properties, and just help your body process, help the immune response. And so we do IV nutrients, and I use kind of a Myers cocktail plus, because I tweak the Myers just a little bit. So it's got a little more vitamin C, a little more glutathione. I believe it's got a B complex and a couple other vitamins in there too. And then sometimes we'll allow patients to just stay while they're getting their IV, since they're already there in the office just hanging out. We have a PEMF mat from Beamer. We have a Beamer device in the office. And so if they can sit on the Beamer and have their IV and just relax for a bit, then that's kind of nice too. That way they leave and they've got a real good head start on healing. On occasion, a patient will want to send that extracted tooth off because they want to see what all was infecting that tooth. And so sometimes we'll do that. We don't do it on everybody, just because it's an extra expense, and a lot of people just don't care. They don't need to know what was infecting the tooth. They just know that it was infected and they needed it out. So if we're testing the tooth, then we will take that extracted tooth and we'll send it to a lab that specifically looks for bugs, bacteria, gross stuff that's in and around the extracted tooth. So that is how an extraction goes at our office. Again, lots of things that we can add, take away if we need to. Some of them are non-negotiable, like ozone. It's in all of our water anyway, so that's a non-negotiable if you're having an extraction done at our office. Some things are negotiable. Like if somebody tells me, hey, I need to get this tooth out, but I just can't afford this whole treatment plan, then we may hold off on the IV, or tell them supplements that they can take it home if they'd like to. So things that we can add, things that we can take away just based on the patient's needs. Same thing with the bone graft. Some people will choose to do that, and that's totally fine. Okay. Hope that helps, guys. We'll see you next time.